Hello everybody, our subject today is osteoporosis, a disease in which bones become brittle and fragile because of loss of tissues, typically as a result of hormonal changes or deficiency in vitamin D or calcium. By the way, bones are not like a piece of wood or a piece of steel. No, bones are tissues. Exactly like skin or liver, in which there is 25% water and 25% organic material and 50% inorganic material, calcium phosphate and calcium carbonate. In the bone, there are two types of cells. Cells which make bone, they are called osteoblasts. Cells that reduce bone, which are called osteoclast. And there is in your life a balance between these two. And so the bone is very active tissue. There is always build up and build down of bone material. Calcium is very important in your body. We need calcium. 1.5 kilogram calcium is available in your body, 99% in the bones and 1% in the blood and the tissues. And calcium is very important for nerve conduction, muscle contraction, and clotting. Calcium is under the control of two hormones. One makes the calcium high, that is parathormone, and one makes the calcium low, that is the calcitonin. They come from parathyroid and thyroid gland respectively. Now, what are the causes? If you reach the age of 30, then the mass of bone is on the maximum. Then after that starts slowly to go down. By the age of 70, 50% of women, they are affected by osteoporosis and only 30% men. Now, what are the causes? As I mentioned, age, if you are getting older, race, the European and the people from Asia, they are more affected. So hereditary factors, diseases like overfunction from the thyroid gland, like diabetes, some disease of the liver and the kidneys, diseases like rheumatoid arthritis, systemic lupus erythematosus, inflammatory bowel disease, tumors, overfunction of suprarenal gland, and malabsorption syndrome. Drugs could lead to osteoporosis like cortisone, anti-epileptic drugs used in the treatment of cancer, and anti-acidity drugs, especially if they contain aluminum, immunosuppressive, and thyroxine excess. A very important factor is that the lifestyle in which you are living. If you are, let me say, lazy enough, you don't move a lot, you use always lifts to go up, you don't use the stairs, if you use the car too much to reach everywhere, so less movement, less physical activity lead to osteoporosis. Smoking and excess of alcohol consumption. And if your diet is deficient in foods rich in calcium or vitamin D. Symptoms: usually there are no symptoms, but the patient may complain of pain, back pain, kyphosis, so the vertebral column will be bending to the front. Very easy to get fracture, especially in three places: vertebral column, hip joint, wrist joint. The patient may complain that he becomes shorter. Treatment is number 1, number 2, number 3, more physical activity. Do more stress for your bones. Do sport, weightlifting. So I don't mean that you have to lift 100 kilogram, but small weights, especially old people, 1 kilo or 2 kilos, they can manage to do it. Stop smoking, no alcohol excess. Your food should be rich in calcium and vitamin D. So you have to drink more milk and eat cheese and egg and fish from North Atlantic. It's a fatty fish. Tuna and salmon as well, sardines. Liver is good, especially from cow and vegetables, especially those with dark green leaves. Nowadays, a lot of food products are fortified with calcium, like, for example, orange juice. For the ladies in the menopause, they can take estrogen, for example. There are side effects, more possibility to get breast or uterus cancer, or to get deep vein thrombosis. For men, to get testosterone as well, but with increased risk of cancer development. A very important drug in this field is the biphosphonate, and there are really different products. The main function of it is to reduce the activity of osteoclast, and for this reason they keep the bone in plus. Denosumab, yeah, this is the scientific name. It is used as injection subcutaneously. Sometimes anabolica are indicated, especially in emaciated people or a very severe osteoporosis. Please keep healthy. If you watch me for the first time, I am Dr. Khalid, consultant physician. Please subscribe to the channel and distribute this video to your friends and relatives. Till the next meeting, goodbye.